Hello, my name is Ingrid Bendeck, and today I will be presenting a clinical case titled Recurrent Hiccups as a Sign of Brainstem Pathology. It is based on a BMJ case report that was published in 2018 by Shastin and colleagues. This case is interesting because it shows how a very common and usually benign symptom can actually be the only sign of a serious underlying condition. So we will start with the chip complaint and the HPI. So the patient is a 67-year-old male who presents with a chief complaint of recurrent hiccups for the past 3 years. These hiccups were persistent and unexplained, and over time he was evaluated multiple times by general practice, ENT, and neurology. Despite all these evaluations, no diagnosis was made, and more importantly, this patient did not report any associated neurological symptoms. So, a review of the systems was done, and the patient was negative for any neurological symptoms. His past medical history included type 2 diabetes, which was diet controlled, and a previous femoral neck fracture. And his family and social history were unremarkable, and he was otherwise independent. So next, a physical exam was done, and it included a full neurological exam, which was completely normal. So there were no focal deficits. But given the chronic nature of his symptoms, further investigation was done with MRI. So, the MRI revealed an enhancing mass lesion located in the foramen of Magendie, posterior to the medulla oblongata, and it measured approximately 13 by 13 by 10 millimeters. Here we can see the actual MRI results from the patient. This finding was very significant because it provided a clear explanation for the patient's symptoms. So after this, an assessment was done, and at this point, the chronic hiccups raised suspicion for a central cause. And the differential diagnosis included an ependymoma, metastasis, and central nervous system lesions. However, histological analysis confirmed the final diagnosis of a hemangioblastoma, which is a WHO grade 1 tumor. So after this assessment, a plan and an outcome was made, and the patient underwent surgical resection of the lesion. After the surgery, he developed a complication of hyponatremia with sodium levels of 117 millimoles per liter. But this was managed appropriately and the patient was stabilized, and he was ultimately discharged home. So the clinical insight of this case highlights a very important clinical concept. Persistent hiccups are not always benign, and they involved a reflex arc that includes the medulla, which plays a key role. So, lesions in this area can disrupt this pathway and cause symptoms like hiccups. For this reason, central nervous system causes should always be considered in unexplained persistent symptoms. In summary, this patient presented with a chronic isolated hiccup that initially appeared benign, but were ultimately caused by a medullary hemangioblastoma. This case reinforces the importance of not dismissing persistent symptoms and highlights the need for thorough investigation when the cause is unclear. Thank you for your attention, and here are my references.